Five signs of low estrogen and why it does matter. Hello everyone, my name is Claudia Vidor. I'm a nutrition and dietetic clinician and the founder of the Period Comeback Protocol. And today I would like to discuss 5 signs where your body is basically telling you that it's running low in estrogen. You may know already about the importance of estrogen when it comes to protecting our beautiful brain, even our heart, our longevity, and definitely our bone health. But today, for the sake of this video, we are just going to focus on your period and your fertility as well. So what are the 5 signs that may be indicating you that your estrogen levels are running low? So the first one obviously is having missing periods, and that's also called hypothalamic amenorrhea. But some women, they do know that their estrogen level is dropping slowly when they start to present with very light period, and they do sometimes last only for a day or maybe a couple of hours, or the period becomes quite irregular, so they get a period once every couple of months, or maybe they get multiple periods in a month, so the periods come every 15 to 23 days. So these could be signs of different hormonal imbalances, but it can also be an indicator that the estrogen level it's running low. Another sign, just to figure out if that's your situation, is your sex drive. If you don't feel that you have a sex drive, if you have noticed that you don't feel attracted to your partner, or you don't have any interest in spending time alone or being intimate with your partner, that's another sign that your hormones are a little bit out of whack. And normally when women start to get the period back, or they do get the period back, they do feel that that change in the sex drive or libido. Some women with hypothalamic amenorrhea, missing period, or hormonal imbalances, they also do suffer from dyspareunia. And dyspareunia is a pain when having sex. There are 2 different types of pain that you may experience. One is a penetration, and one is when the penis is inside the vagina. So when the pain is experienced, especially at penetration, it's an indicator that there is not enough vaginal lubrication, and maybe this the nervous system is quite dysregulated, and there is quite a lot of anxiety about having sex and about intimacy. And that's definitely something that you can work with a professional like myself, or something that you can also talk about with your counselor, psychologist, or with your medical doctor. Having painful sex is not normal and can be caused by different things, like also STI, bacteria, parasites, and and other bodily issues, but it's definitely something that need to be tackled sooner rather than later, so that you can have a more joyful life and definitely a joyful experience when spending time with your partner, especially if your ultimate goal is fertility and having a baby. So we have already discussed about the light periods, the light periods or the missing periods, the decrease in sex drive. Another things that I normally notice with women suffering from irregular periods or missing periods is the need to go to the bathroom multiple times during the day, but especially at night times. So women that do experience hypothalamic amenorrhea, they tend to wake up at least once or twice, or sometimes even 3 to 4 times in the middle of the night to go to the bathroom to pee, even though they don't consume a large amount of water just before going to sleep. And that's because when the estrogen levels are low, the urethra becomes really hypersensitive and it's thin out, which is why you may get woken up by a desire and need to go to the bathroom. Something that I notice with my clients is that when they start to get that estrogen level back up, their need to go to the bathroom in the middle of the night decrease, which means that they have better sleep quality and less anxiety and simply more energy throughout the day. Another signs to watch out for is definitely night sweats. So if you wake up in the middle of the night and you need to change your blankets, your doona, or you need to have a shower or get changed because you're soaking wet, that's another sign that your hormones level are pretty low. That's commonly seen during perimenopause and menopause, but also when women are suffering from hypothalamic amenorrhea, and once again, they don't have enough estrogen. Sometimes the night sweats are also combined with the vivid dreams. They don't necessarily have to be nightmares, but specifically vivid dreams. And that's a feeling that you wake up in the morning and you feel quite happy or sad or anxious about something. You do remember that you've spent the night dreaming a lot, but you don't exactly remember what you dreamt about. And so that's normally what vivid dreams look like. And they do sometimes interrupt a sleep, especially a deep sleep. And then last but not least, if you have low level of estrogen, irregular periods, no periods, obviously your fertility and your fertility chances are going to be impacted, and your cycles are going to be anovulatory. If you want to get a baby, the first step is to boost your hormones so that you can see regular ovulations, and so that you can time when to have sex with your partner, and ultimately you can have a baby. So just to sum it up, how can you detect if you have low estrogen? First of all, look at your 5 vital signs. Your period, are they regular? Are they light? Are they too close to each other? Are they far apart from each other? Have they gone missing for many months or years? So chances are that if that's the case, you have a low estrogen level. Second one, anovulatory cycles, unexplained infertility, also called subfertility. That's possibly another sign that your estrogen level are low, or that you're suffering from a hormonal imbalance. Low sex drive or pain during intercourse is definitely another sign, as much as night sweat and vivid dreams. And also, last but not least, is waking up in the middle of the night for the need to pee. There are many other things that can, many other signs that can really tell you that you're running low in estrogen. But the best way for you to move forward is to simply start by gathering some data, meaning just go to your medical doctor, ask to test for a few of the sex hormone panel, including androgen and prolactin. Check your thyroid, check your full blood count, your iron level, and then bring those results to someone like me. I'm a nutrition and dietetic clinician, and I have a very holistic approach when it comes to getting your period back and also getting your fertility back. There are a few tips that you can focus on, especially if having a baby is your ultimate goal, and that's something that we are going to talk about in the future videos. If you are at the point where you would like to get some support and some help, please feel free to start by downloading my free ebook, my free fertility ebook, or simply organize a free call with me, because it's your chance to really have a chat with someone that has been there, has gone through hypothalamic amenorrhea, has gone through infertility, and I'm here to support you during this journey. Thank you so much for listening, and I'll see you next time. Bye for now.